Well, it's time for a health report, and joining us now is Africa 54 health correspondent Lino Mudu with new information on rare diseases. Lino.
That's right, Vincent. Wolfram syndrome, amyotrophic lateral sclerosis, or ALS, leprosy. Well, what do they have in common? They are all classified as rare diseases. Each year, on the last day of February, the world commemorates a Rare Disease Day to raise awareness about the group of conditions and their impact on patients. Experts say a rare disease is any disease that affects a small percentage of the population. Most rare diseases are genetic and are present throughout a person's entire life, even if symptoms do not immediately appear. Well, get this. There are 7,000 types of rare diseases, approximately, and 350 million people suffer from a rare disease globally, and 5% of rare conditions are treatable. For more on rare diseases, I am joined live via Skype by Kelly du Plessis. She is Managing Director of RareX and CEO and Founder of Rare Diseases South Africa. Kelly, welcome to the show.
Thank you so much for having me.
Great. And joining us in the studio is Sika Dunyoh, Director of Education Programs with the U.S. National Organization for Rare Disorder. Sika, thank you for joining us.
Thank you so much for having me and for recognizing Rare Disease Day.
Absolutely. And I will start with something that may seem superficial for some people, but it's actually very significant, which is your wardrobe, particularly your scarf. It's a zebra scarf, and there is a link to Rare Disease Day.
Sure, yes. So I work at the National Organization for Rare Disorders.
Yes.
And today we are pushing our Show Your Stripes campaign. Many people in the rare disease community know, you may not know, many people may not know that physicians are often educated to assume when they see a patient in an exam room that that patient has a common disease. Mm-hmm. There's a saying that they're taught, when you hear hoofbeats, think horses, not zebras.
Okay.
And so we want to push that it could be a zebra. Mm-hmm. And so Show Your Stripes and me wearing my stripes today is to really commemorate the campaign and to raise awareness for the community that we are here, the rare disease community is here, and we're here in great numbers.
Absolutely. And Kelly, let me come to you. What is the incidence of rare diseases in South Africa? Is it even, are you even able to tell how many people are affected?
Sadly, we are not. We have really, really poor data coming out of our country at the moment. And that is one of the biggest challenges is that we have is lobbying to government to understand that rare diseases are, in fact, a public health priority when we have such limited data. Based on international prevalence, we should expect to have about 3.6 million South Africans impacted, given our population size of 56 million. But in actual fact, we do not have a rare disease registry to actually prove those statistics.
Wow. You know, Sika, I would like your reaction to that. No rare disease registry in South Africa and in Africa as a whole. As I was doing the research.
Sure. What
is being done in the United States that perhaps can be a lesson learned for other countries to replicate?
Sure. You know, really understanding the size of the population is even difficult here in the United States. Some of the numbers that we've given are estimations, mm-hmm. And without having a countrywide registry, it's difficult. I think some of the lessons that you know, I can impart to other countries, including my homeland, Africa, I'm a Ghanaian, is that, you know, really working with institutions, research institutions that have a good infrastructure in place to implement and institute registries. We're seeing a lot of that across the United States. NORD has its own registry platform as well. Mm-hmm. A lot of the rare disease communities come to NORD to see, you know, how many people in the population in that community are afflicted with this particular rare disease. What do their symptoms look like? What does their day-to-day look like? Mm-hmm. Hopefully that information, that data that's collected may lead to future research that may lead to therapies.
Okay, and Kelly, talk to us about what you are doing right now through your organization to help those that you are able to identify.
So we have really started with patient advocacy and activism in terms of government controls to make sure that government recognizes us. We are obviously in a period of change with NHI being looked at to be brought into our country. And with that, lobbying for inclusion of rare diseases as part of universal healthcare has become such a critical issue. But we also have a very divided healthcare system in the sense that we have a certain percentage of the population receiving healthcare through private sector. So it's very, very difficult because you're almost having to do the work twice on both sides to make sure that it's aligned and that there is equitable healthcare.
And Sika, you got involved actually in the rare disease advocacy and work because you were affected through your sister. You saw a journey, you experienced a journey with your sister's diagnosis. Even though it was very long and difficult and complex, we can definitely understand that. Could you perhaps summarize a little bit with regards to how that journey was like?
Sure. You know, my sister was a vibrant 21-year-old. She was a typical 21-year-old. She was going to school. She, you know, went out, had fun, but she started suffering from symptoms that were very odd for someone her age. She went to multiple doctors. She received a variety of different diagnoses and was given treatments and therapies that didn't lead to improved health. And so by the time she was diagnosed, she was very sick at that point. Unfortunately, about a year and a half later, she lost her life due to complications of relapsing polychondritis.
And that experience was here. She was living here.
Yes, she was living in the U.S. And so, you know, a lot of people here in the U.S. really struggle with getting early diagnoses, with getting treatments to treat their rare disease, because about 90% of rare disease communities don't have an approved FDA treatment. And so you can imagine that the journey to diagnosis and treatment is even that much more difficult in countries back home in Africa.
I'm sorry about your sister's experience. That's very, very sorry. And Kelly, let me come to you and ask you, what would you like to see in the future? I mean, there's so many things that really need focus and time and resources, but very quickly, what would you like to see?
I would definitely like to see an improvement in the resources in terms of diagnostics to make sure that patients receive appropriate diagnoses early on and at appropriate times, and then obviously improved access. We want to make sure that no patient's left behind and everybody who has been diagnosed receives the treatment that they truly deserve. Okay,
Kelly, thank you so much for joining us. That's all the time we have. We have to leave it there.
Thank you so much.
Sika, I appreciate your time. Thanks for coming.
Thank you so much.
And that was Kelly du Plessis, she is CEO and founder of Rare Diseases South Africa, and Sika Dunyoh, Director of Education Programs with the National Organization for Rare Disorders. And Vincent, that's our health report for today. To stay in touch, find me on Twitter @LenorMoudou. Vincent, back to you.